Welcome to 4,500 Births Later. We're Sarah and Catherine, two Canadian labor and delivery nurses. And between us, we've supported over 4,500 births. Each episode, we break down what really happens in labor, delivery, and postpartum. Cutting through fear and misinformation, we give you honest guidance from the people who do this work every single day, so you can walk into birth feeling calm, confident, and supported. Now, I think we should go ahead with closing your eyes, or you don't have to close them, but just imagining coming into hospital on January 13th and just knowing kind of what your surroundings will be. It's going to be calm. It's going to be exciting. You and Mark are going to have a fun night knowing that in the morning you're going to have your baby. So hopefully you've had a good rest. And then you come into hospital, go to the labor and delivery floor. Typically, they see you at the triage desk first just to check you in. And then you'll be brought to your prep room. And in that room, that's where the nurse will start your IV. The reason you need an IV is so that the anesthesiologist can give you medication through your IV throughout the surgery, and also to keep you hydrated because you haven't had anything to eat or drink. They typically keep you NPO or nothing by mouth for at least 6 to 8 hours before your surgery. So you come in, you haven't had breakfast, so you're feeling a little hangry. So we like to get that IV in, give you a nice bolus of fluid so you feel a little bit brighter. You and your baby enjoy that. And then we get the monitors on.
Yeah, we get you to, did you say you already change into a gown? And
No, I didn't.
we change you into a hospital gown?
So you're in a hospital gown, you've got your IV, we're listening to your baby, and that's basically it for prep. So it's quite simple. And a lot of people think, why the heck did I come in here so early? Seriously.
So how many, if my schedule time is 2 p.m., what time do I go in?
So typically we like you in kind of 2 to 3 hours before your surgery, like before, we call it cut time. So before you're physically on the table being cut. Sorry if that's dramatic. Are you okay?
Welcome to the
wait.
business.
No, this is exactly what we wanted to walk through. Like, what does this look like?
Yeah.
Because if you haven't gone through it, you don't know. And it's nice if you are knowing you're going to go into it. Hearing this would be reassuring, right?
Catherine, did you mention apple juice, the carb loading?
No.
So something that we've started doing the past year is carb loading. And so you'll be given the time that you're supposed to come to the hospital, the time in which you can have your last solid foods, the time in which you can have your last clear fluid, which often is a chugging back of about 500 mils of clear apple juice or clear cranberry juice. You have to be able to see through it. So it can't be nice and organic. It's probably the one you get from the juice box, right?
Mm-hmm.
But this really helps you to have more energy going in. And then also it helps with your recovery afterwards. So that's, as long as you're not diabetic, that's something that's highly recommended. Now, the trickiest thing when you have a booked C-section is that the obstetrician is there to do the booked C-sections, but they're also on the other side with all the labor and delivery and triage, everything that's coming through the door with that. And so there is a very high likelihood that your C-section gets delayed. And then sometimes there could be a delay upon the delay upon the delay. And so, as nurses, we do the best we can to, see big picture what's going on. And if it looks like it's going to be an extended period of time, we advocate for you to have some more juice to keep your energy up because it's hard. You're pregnant. You don't have anything in your stomach. Some people feel really nauseous when they don't have any food or beverages in their stomach. And it's like a horrific feeling.
Yeah.
Dads get hangry. So we want to make sure that they're eating and drinking. They should probably do that outside of the room so that it doesn't affect the mom.
Note.
But that I think is a really big thing for people to keep in mind because it can be a long day.
Yeah.
And I would say, and feel free to weigh in on this, Catherine, the likelihood of things going on schedule are pretty slim.
Good to know. It's good to be able to mentally prepare
Yeah.
careful.
And I thank you.
Mhm.
Thank you for taking that so graciously, because it's really hard for people.
It was also
Yeah.
better to think about it now rather than in the moment. And if I got pushed, is there like okay, come back tomorrow? How often does that happen? Or is it you'll be seen within 24 hours? Like, what's it?
I would say within 24 hours. It's pretty rare come back tomorrow,
Okay,
but sometimes if it's looking
nuts in
like,
there.
yeah.
Does the full moon impact this?
Oh, yes, yes, yes. Yes.
water breaking
Water
everywhere?
breaking. Yes, yes.
Really? We gotta
yeah.
check
Yeah.
the moon on that day.
Yeah.
It seems to be on either side of the full moon. So not
Full and
necessarily,
new?
well, like the days on either side of the
Okay,
full
got you,
moon.
got you.
Yeah. And then you're in the OR hallway. From there, you'll go into the OR. And from the OR, you'll go into the recovery room. And then from the recovery room,
Labor and delivery.
over on postpartum.
Postpartum,
Yeah, the other side. So that's when we usually say, bring all your stuff up then, but maybe not all of it either, because the rooms aren't very big. But in the OR hallway, when they do that briefing, that's when we'll give you a dose of antibiotics as well that we like to have in the OR. And there's bright lights. And you probably walked into the OR with your surgery that you had, right?
Yes.
Yeah. So kind of different than your everyday life,
Yeah.
right? Like a different
It's
environment.
A weird room.
Yeah.
It's like bright, like what do you call it? Almost like theater lights.
Yeah.
Yeah.
Mhm.
Yeah. And like it's been referred to as the theater.
Mm.
I think that's from the UK, that term.
It is.
Mm.
But
They're called theater nurses.
yes. Very dramatic. No. So you walk in there and then you have a little step stool to step up on.
Yep.
Open up the back of your gown and your bare bum is going to go, or your bare bottom is going to go onto the OR table.
No undies.
No undies.
Nothing on. No bra, no undies, no
Nothing.
socks.
Yeah.
Nothing.
No
You-
jewelry.
No jewelry.
jewelry.
I have been caught a time or two as a nurse, and all of the other nurses give you the eye roll when you bring a patient into the OR and she's got her underwear or got her bra on or something like that. It's not a good look.
Exposed, your bare bottoms on the table. You get into the same position as you did for an epidural. So the feet go up on a little stool. Usually your nurse, your primary care nurse, will be in front of you with their hands on your shoulders to keep you nice and even.
Mm-hmm.
And because the OR tends to be a bit cold too, just let the nurse know if you're feeling chilly. Sometimes when you're pregnant, you feel a little hotter than you usually do. So it's hit or miss,
Mm-hmm.
but there's an endless supply of warm blankets that we can bring to you. And then the anesthesiologist paints your back with a cold, wet, sterile solution, puts up a plastic drape, puts in a little bit of freezing, those quick pokes that you probably remember from having the epidural. They kind of sting a bit, but I don't know, compared to contractions, it's not that bad.
I don't remember, yeah.
And then the needle goes in to the spinal space. Once they've deemed they're in the correct space, they put in some medication, out goes the needle. And you may say, oh, my bum feels kind of warm. And at that time, we're getting you to lie back very quickly, get your legs up on the bed, because with the spinal, it's going to affect your motor control too. So once you're settled on the bed, you probably won't be able to lift your legs.
Mm-hmm.
Or if you can, that will be temporary. Once it's fully settled in, you shouldn't be moving your legs around. But I think this point can be a very vulnerable point for the mom, because you're lying down, right? There's this different sensation. And then you've got at least 2 nurses and an anesthesiologist all up in your business, right? Like they're untangling you, making sure that the blood pressure cuff is on.
Okay, we're throwing a lot of information at you. How is it feeling?
No, it's
Like what are your thoughts?
I'm happy to know some of the steps, some of the things to expect. I think that it helps when you can paint a picture, and especially the timeline. I think that's good for me because, I actually had a DNC. I had a miscarriage before all my births,
Yeah.
and I was there for 20 hours, just continually getting bumped because it was
Hmm.
low priority kind of thing. And it was really hard. So mentally preparing for being bumped, that's been really helpful. When can I turn my music on?
Yeah. So great question. And you are also asking things that you can bring into the OR.
Yeah.
Yeah. So a lot of hospitals supply speakers.
Okay.
At our hospital, we have a speaker in the OR.
Okay.
So you can just link up your phone, have a playlist ready. We will play anything you want.
Connected to my phone.
Yeah, connected to your phone. Or if you just want to tell the nurse, I love this artist, she'll put it on her phone,
I'll
play the
connect
music
mine.
for you.
Yeah.
You've got your playlist.
Mhm.
So yeah, that's a big thing, music. So the minute you enter, well, the anesthesiologist has to talk to you about certain things when they have to get your consent for the spinal, and they really do need you in a certain position for that. So yeah, probably after the spinal has gone in. Once
Okay. And then I lay down and
you lay down on the bed, the OR table is extremely small. So you kind of feel the edges of it and lie back down. You're flat on your back, but then very quickly the anesthesiologist has a button on the table where they can rotate you to the left.
And it sounds like this.
Because we want you
There's the sound.
off your inferior vena cava so the baby's getting lots of oxygen. And I myself remember they hadn't tilted me immediately after, and it feels like an elephant is sitting on your chest.
yeah.
So it feels so nice when they tilt you.
The bed tilts you?
The whole bed.
Like a forklift? Like
It's like a Disney ride. Like you're flying, but you're
is
tilting
there a
off to the
ledge to
side.
catch you?
So we put a seatbelt on.
But
your
before
legs.
that, there's a nurse there to catch you.
We haven't dropped anyone to this day.
True.
Yeah, true story. Anyway, we tilt you to the side. Your arms are to the side.
Are they being supported?
Yes, they're nicely supported with pads, with pillows, sorry.
And armrests.
Yeah.
Like they're armrests, so that it can take your full weight. You don't have to
Mm.
hold
feel
it
like
up at
you're
all.
suspending.
There's a blood pressure cuff on one side. The IV is typically on the other side. And then we put some stockings on your legs. They're called SCDs. And basically what they do is they go around your calves and they squeeze. Do you remember this from
No.
anything? No. So anyway, they go just kind of from your knee down to your ankle. They compress, and the purpose of them is so that they're pumping blood, because after a cesarean section, you're not getting up and walking around for the first kind of 4 to 6 hours.
Mm.
So your blood isn't pooling, it's
Mhm.
pumping
So those stay on.
until you're
Wow.
up and moving.
Usually once you start mobilizing.
Yeah.
Consistently.
Once you're
We'll
walking
stop.
around, okay,
Yeah.
they'll come off.
So that's happening. And then one nurse is listening to the baby's heartbeat to make sure that the baby is tolerating it well as well. Like, because there can be a drop in your blood pressure, which can drop the baby's heartbeat.
Mm.
So there's a quick listen there. And then once the catheter is in, and that's what drains your bladder, they straighten out your legs, cover you with a blanket, put a little seatbelt on to keep you nice and secure there. And then you hear the words, okay, she's ready to prep, after they've tested you to make sure that you are numb enough.
And then at this time, we're paging the surgeons to come in. At this time, your husband is still out in the hallway. So the surgeons come in, they get in their scrubs, get their gloves on, and they come over and pinch your skin with a pair of tweezers.
The things that you will feel is tugging,
Yeah.
like as they are opening things up, and pushing pressure. So as the baby's
So
coming
they
out,
pressuring like this to get baby out.
yeah. So they cut an incision maybe that wide. They don't make it really wide because they want to facilitate that good squeeze the baby gets with a vaginal
I
delivery,
didn't know that.
which helps,
the lungs.
get all the
Oh, my
the
husband's
fluid out of the
He's
lungs.
gonna be happy to hear that.
Yeah. So they make quite a small incision, and it's a team effort between whoever's assisting the obstetrician and the obstetrician, because they're reaching in and then one is pushing down and they're really communicating and talking, and they say, you're going to feel pressure. And sometimes like you feel like you're winded.
Yeah, you're breathing
Whoa.
through this part because they
Yeah.
are pushing on your abdomen. So it's not comfortable.
No, but it's not
comfortable.
painful either. Like
Mhm. It's pressure.
like-
there's a lot of pressure.
So then once the amniotic fluid amniotic sac is cut,
Mm-hmm.
lots of water comes out.
Yes.
Yeah.
Yeah.
And then there's
Big gush of
suction.
water.
trying to
Is that
clean that all
cleaning
up.
Yeah.
Yeah. I bet
And
it's flying
going
everywhere.
into a canister beside you.
Can you use it for
fluid.
gravy later?
There you go. Yes, yes.
We use it for math later. So we estimate how much amniotic fluid came out.
Okay.
And then, because there is some bleeding that happens too.
Right.
So we kind of mark that in our head. And then when we see the blood come out, we subtract the amount of our estimated amount of amniotic fluid to come up with blood loss.
Your blood loss.
Okay.
Yeah.
Okay. So amniotic fluid comes out.
Mhm.
You catch it all with a vacuum.
Yep.
So,
Happening.
but that's so opening happens. Now they're pushing,
Mhm.
pushing, and the head pops out.
Mhm.
And
And-
then he takes his first breath.
Sometimes it's when his whole body's out.
Okay.
So-
So how long do you feel like is the average pushing on the belly to?
Very brief. Very brief. Like, I don't know.
Seconds.
Yeah.
Like a
30
minute would be a long time.
seconds, Yeah. To a
A
minute.
minute would be a long
Yeah.
time.
Mhm.
Yeah. Yeah.
So plop plop, he comes out. They
Yeah.
lift him up. Now what?
They play the Lion King song. They drop the drape.
They drop the drape.
If,
That's a
if
choice.
you
want.
want it. If you want
Yeah.
it. If your husband's going to hit the floor, they keep the drape up.
Yeah.
Mm-hmm.
And they dry and stimulate the
I want it.
baby. They show your baby. You know, the angle of the baby, the first glimpse, maybe not the best because they're,
Yeah. Yeah.
Look like
That's
an angry old
a
man or
vaginal
woman.
birth too, right?
yeah, that's true. Very true. Yeah. So, and then they hold the baby in their arms and they continue to dry and stimulate the baby because they still do delayed cord clamping.
Yes.
So 60 seconds, then
Who's
clamp.
counting?
The probably the respiratory therapist that's over by the Panda, which is the little machine that we have that has a heater over top
Mhm.
and then suction and oxygen for the baby. So there's a little button there. It's a big part of their job is to hit that button as the baby's born. So it
Okay.
starts counting. And then the numbers are big enough that we can see it over at the OR table too. But then we also hear when it gets to 1 minute and they will say that's 1 minute. And then
Okay.
if they have concerns and baby's not really making a respiratory effort, they may cut and clamp the cord sooner or clamp, then cut the cord.
And they
Yeah.
never go over 1 minute.
Rarely. Sometimes it can be a little bit longer, but
Yeah. The concern there is that your abdomen is open.
Mm-hmm.
And this is the point where you do start bleeding.
Right.
So it's not optimal to keep the abdomen open, like the risk versus benefit.
Yeah, that's
is
exactly what
there.
Dr. Lee
Yeah,
said.
yeah.
So baby comes out. He's still attached to the umbilical cord, obviously.
Yeah.
A minute, are you just like holding him?
Mhm.
Holding him up?
Mhm.
Someone's warming him up.
Yeah, the doctor's got him here.
Okay, checking. He's doing well.
Yeah.
When do they start pulling the placenta out?
So we've clamped and cut the cord. Baby's gone over to the warmer, and now they're coming back to deliver the placenta. It's nice and
Can I
easy.
not hold my baby before the placenta comes out?
They like the babies to go over to the warmer for an APGAR, which means they're going to check for respiratory tone, color.
How long does that take?
So we do a 1 minute APGAR and a 5 minute APGAR. So typically by the 5 minute APGAR, the baby is over to you, skin to
On my
skin.
chest.
On your
And
chest, yeah.
the gown,
Mhm.
it's open in the back. So how can I do skin to skin?
We have snaps on the arms.
Okay,
So you
cool.
can unsnap the gown and bring
This
it
is
right
helpful
down.
stuff.
Yeah,
This
yeah.
is helpful
Oh,
stuff.
good.
Mhm. So yeah, that's really nice to do. But it's cold in the OR as well. So typically we'll put the baby on your chest and we'll put a
A
nice
warm blanket.
warm blanket over you guys and your husband because you're kind of, you're on drugs.
Mm-hmm.
So your husband will help you hold the baby.
But I should have one hand to hold him
Yes. Yeah.
because the other one's connected to the heart rate thing.
To the blood pressure cuff.
Right.
Yeah. Blood pressure cuff. And yeah, the other one does have an O2 monitor on, which can make it tricky. It's a little thing that clamps on
Yeah,
your
yeah, I
finger
know.
to check your oxygen level. So that's on the other side. So again, depending on the anesthesiologist, that will determine
Yeah.
which
Okay.
arms are on the baby.
Well, thank you for being with us today. It was so
Good.
wonderful to hear your questions and thank you for being so open and vulnerable about your own birth experiences. We're excited about your baby coming
Thank you.
and
Thanks for having me on. Honored to be on the podcast.
Yes, thanks for coming.
And I just wish you many blessings on all of your podcasts and what it will bring for you guys.
Thank you very much.
Yeah.
If you have any questions about what you heard today, please reach out. Sarah and I would love to hear from you. Email us at birthslater@yahoo.com. That's birthslater@yahoo.com. We are here to support you every step of the way. And now for the legal language. This podcast is solely for educational and entertainment purposes. This podcast is not intended as a substitute for professional advice from qualified individuals involved in your prenatal, labor, and postnatal care. Every pregnancy and birth is different, so always talk to your healthcare provider about what's right for you.